worried because you have blood in the semen? And are you looking to know what is causing this problem? Or what could be the causes of this irregularity? Or what would you have to do to feel more sure about the possible causes of your problem? Discover in about 3 minutes 7 causes of bloody semen and what to do. Welcome to my Health and Nature channel. Today we will discuss a special topic that interests you. Possible causes of blood in sperm, causes of bloody ejaculation and what to do. Please, like the video. Subscribe to the channel and activate the bell to receive more information. Now I am going to show you 7 causes of bloody semen and what to do and all the benefits that it brings to your health. Blood in semen is not usually a serious problem and tends to disappear on its own after a few days, without the need for any specific treatment. Already in cases where blood rises after 40 years of age, it can, in some cases, be a symptom of some more serious health problems such as vesiculitis or prostatitis, which need to be treated, and it is necessary to consult a urologist to identify the cause and start proper treatment. However, in either case, if the blood appears often or takes more than 3 days to disappear, it is recommended to consult a urologist to identify the cause and initiate appropriate treatment to cure the problem or relieve symptoms. The most frequent causes of blood in the semen are trauma and inflammation in the male reproductive system. However, bleeding can also arise due to medical examinations such as prostate biopsy or more serious problems such as sexually transmitted diseases or cancer. Number 1. Lesions in the genital region. Injuries to the genital region, such as cuts or bumps, are the most common cause of blood in the semen before the age of 40 and, normally, the man does not remember that it happened. Therefore, it is important to observe the intimate area to look for any cut or other signs of trauma such as swelling, redness or bruising. What to do? Normally, in these cases, the blood in the semen disappears in approximately 3 days and, therefore, no specific type of treatment is necessary. Number 2. Use of anticoagulants. The use of some medications, especially anticoagulants such as warfarin or aspirin, increases the risk of bleeding from the small blood vessels that are in the path of semen, and may cause blood to leak during ejaculation. However, this type of bleeding is oddly enough. What to do? If the bleeding lasts more than 3 days to disappear, it is recommended to consult a urologist, and you should take all the medications you are taking to assess if any of them is the cause of the bleeding and if any need to be changed. Number 3. Biopsy in the prostate. Prostate biopsy is a type of invasive examination that uses a needle to remove a sample from the organ, and therefore bleeding in the semen and urine is very common due to trauma caused by the needle and rupture of some blood vessels. What to do? Bleeding in the semen is normal as long as it appears up to 4 weeks after the examination. It is only recommended to consult the urologist if excessive bleeding or fever above 38°C appear. Number 4. Inflammation of the prostate or testicles. The inflammations that can appear in the male reproductive system, mainly in the prostate or testicles, are one of the most common causes of blood in the semen and, therefore, it is important to be aware of other symptoms such as fever, pain in the intimate region or swelling of the testicles. What to do? If there is suspicion of inflammation, it is advisable to consult a urologist to identify the type of inflammation and start the appropriate treatment, which can be done with antibiotics, anti-inflammatories or pain relievers. Number 5. Benign prostatic hyperplasia. Prostatic hyperplasia, also known as an enlarged prostate gland, is a very common problem in men after age 50 and a major cause of semen blood in older men. This type of problem is usually accompanied by other symptoms such as painful urination, difficulty urinating, or a sudden increase in urinary frequency. What to do? Prostate exams are recommended after age 50, which may include a digital rectal exam and blood tests to identify any problems with the prostate and initiate appropriate treatment. Please, remember to like the video, subscribe to the channel and activate the bell to receive more information. Number 6. Sexually transmitted infections. Although rare, the presence of blood in semen can be a sign of the development of sexually transmitted infections such as genital herpes, chlamydia or gonorrhea, especially when it arises after having sexual intercourse. They are protection. What to do? If you have had intimate contact without a condom or other symptoms arise such as discharge from the penis, pain when urinating or fever, it is advisable to go to a urologist to order blood tests to confirm the presence of any transmission disease sexual. Number 7. Cancer. Cancer is one of the rarest causes of blood in semen, but this hypothesis should always be investigated, especially after the age of 40, since prostate, bladder or testicular cancer can, in some cases, provoke the appearance of blood in the semen. What to do? A urologist should be consulted if cancer is suspected, or routine examinations should be carried out after the age of 40 to identify the risk of cancer or the cancer itself, to start the treatment indicated by the doctor, if necessary. Tell me in the comments what you thought about this recipe and if you know. We upload videos every week of this and other health topics. So if you want to receive more advice, like the video, subscribe to my channel, activate the bell to receive notifications. You are an amazing person. Wow! You came to the very end of this video. It would be very appreciated from the bottom of our hearts. Also, if it's possible, like, share and comment. Thanks. Thanks very much.